Doctors are warning that sudden cardiac arrest affects children far more often than most realize and say that recognizing the warning signs can make all of the difference. WAVE News reporter Kirsten Foote explains.
1 in every 70 schools will have a sudden cardiac arrest event each year. Kentucky schools are required by law to have cardiac emergency response plans. Nationally, more than 350,000 sudden cardiac arrest events happen every year, and more than 7,000 of those involve children. Norton Children's cardiologist Adam Scaff says certain symptoms in kids can indicate increased risk for cardiac arrest. Those include chest pain, dizziness, heart palpitations, fainting, or shortness of breath.
Those are very common symptoms, and if those become prevalent in your child's history while they're playing sports or even at rest, it's important to talk to your doctor about those because it may warrant further cardiology evaluation.
He adds that in the event of cardiac arrest, providing CPR quickly is key, and he encourages everyone to learn the potentially life-saving technique. Kirsten Foote, WAVE News.